Welcome back. It seems many of Africa's healthcare systems are anything but healthy. KPMG's latest audit reveals that Africans tend to live 14 years less than the global average and 21 years less than the average European. Well, let's explore now the findings with KPMG's Robert Brown. Robert, good morning. Thank you very much for coming in.
Thank you.
Can we start first at home? How does South Africa compare with the rest of Africa?
Well, in terms of life expectancy, South Africa is higher than the average across Africa, and in fact has made some huge increases in recent years, largely due to the HIV and AIDS work, the rolling out of antiretrovirals. But that's still a long way behind where you would expect it to be, and there are still some significant challenges in South Africa.
Okay. Now, will the proposed NHI, the National Health Insurance that the government wants to put into place over the coming number of years, help South Africa?
Yes, I mean, I think if it can be successfully implemented, absolutely. It combines an expansion in the level of coverage that will be available to, particularly to the poorest members of society, also with a number of improvements to things like infrastructure and the quality of service delivery. But the trick will really be in implementing it successfully and at low cost, which is perhaps the biggest challenge.
Yeah, I guess the cost is a problem. How do you provide low-cost health, but also in a high-quality way?
Absolutely, and that's something really that people are struggling with across Africa in many different countries. In South Africa, for example, there are examples of fantastic quality of care, particularly in the private sector, but also in the public sector. But in order to deliver that at a much lower cost, we need to look at much more innovative solutions, ways to deliver healthcare with a shortage of doctors and difficulties with infrastructure. And that's really about learning lessons from other countries and other continents, indeed, that have delivered low-cost and high-quality healthcare.
Okay. Now, in the report, it says the state of health will not improve in Africa for many years to come. That's what kind of statement you've made. Why is that?
Well, mainly it's because it takes a long time to make these kind of improvements, and because Africa and many African countries are starting from quite a low starting point in terms of coverage. So if you take Nigeria as an example, Nigeria is dealing with 10% of the world's disease burden, with only 2% of the population. The level of coverage that Nigerian people have in terms of their access to healthcare is currently very low. It's somewhere between 4% and 5% that's covered in their national health insurance scheme. Having said that, Nigeria is at a very interesting point and something of a tipping point, that if there's the political will to increase that number of people covered by national health insurance, there are a number of private sector HMOs and insurers who are very willing to be involved in delivering low-cost, high-quality healthcare.
Okay, there must be some success stories around Africa. Did you find any? Yes,
there are many. I mean, countries like Ghana have increased the proportion of their population who have access to free medical care enormously and very rapidly. So it's not something that can't be overcome. Rwanda similarly has increased the amount of money that the government spends on healthcare very rapidly.
Okay, you mentioned HIV/AIDS earlier as one of the challenges facing Africa. What are other challenges facing healthcare policymakers in our continent?
Well, there are a number of diseases there are a number of communicable diseases like HIV and AIDS, like TB and malaria, that are typically associated with developing economies, and Africa has a huge burden of those. But one of the real challenges facing policymakers is that at the same time, many African nations are becoming far more wealthy very rapidly, and that brings with it what we call non-communicable diseases, or what are often known as lifestyle diseases. So cancers, heart diseases, diabetes, the sort of illnesses associated with obesity. And that combination of non-communicable and communicable diseases is a very difficult thing to deal with, and governments are struggling to deal with that with limited infrastructure and quite importantly, a lack of doctors and nurses across the continent.
Okay, thank you very much, Robert. That's Robert Brown, Senior Manager for Healthcare at KPMG.
News that moves. eNCA.com.